Assalamualaikum. Good morning. Welcome to the 24th Medical and Health Week. I am Dr. Nurhaslinda Abdulaziz, your moderator for today. It's Module D, Statistics in Research. Fellow audience and our esteemed guests. Today's speaker is someone whom very familiar to us, Associate Professor Dr. Azmi Mohd. He's also the recipient of this year's Special Excellence in Service Award of the MPP2022. Associate Professor Dr. Azmi Mohd is a 55 years old UKM lecturer who has retired this year. This is his last research week for the session, and as a student in UKM, he was a nuisance to his JKM lecturer for disputing a statistical formula taught. Later, he ended up dreading with some of this happening back to him. So graduated from UKM in 1992, he taught statistics in UKM since 1996. He is the ultimate example of the frog under the coconut shell, as he quoted, since he never left the UKM. More well known of the internet as a technology enthusiast, rather than the other epidemiologists in biostatistician, he has many blogs on his interests such as gadgets, hacks, and triathlon as a hobby, cycling, and statistics in blogs such as the website of drtamil.me. He's also a YouTube channel on statistics and cycling. Do check his website as stated. So he believes that it's freeing sharing and knowledge. Therefore, videos and noted to all his statistic lectures is available online. So just Google his name, Dr. Azmi Mohd, so you'll be set for the analysis. So without further ado, I would welcome Prof. Dr. Azmi Mohd to follow the session. Thank you.
Thank you very much, Madam Chairperson. Today, I've been on a very long leave before my retirement. So it is sort of difficult to start teaching again. Okay, allow me to share the screen. Okay, so, I got double screen. Okay, I'm not sure what happened. I let the technical people sort it out. Okay, basically today we're going to start with this lecture on sample size. So I know the title is 2014. Sorry, I forgot to change the date. Okay, first and foremost, as you already had the lectures on study designs with Prof. Madhya Dr. Azmi Mohd and Prof. Zaleha 2 days ago. So today I'm going to cover on the next part, which is sample size calculation. So if you already have collected your data, if you are going to submit your proposal, among the things that are being asked for by the committee is whether you have adequate sample size or not. Okay. So today I'm going to cover that part. So hopefully this thing you can sort out. Okay. Okay. What's happening right now, my screen, they changed, I don't know why. I got 3 screens here, but somehow my PowerPoint is not coming out. Okay, so let's, okay. Okay, so let's talk about sample size. Why do we have to calculate sample size? Why do we have to calculate sample size? So right now, the reason why we have to calculate sample size is because if you do a study with a sample size that is too small, you're going to end up with problem with trying to get a significant difference. So I'm going to start with a simple example here. Okay, in this simple example, we are showing you a sample size of 8. Okay, so you can see here we have a sample size of 8. Okay, allow me to get myself to disappear. Okay, now I'm gone. So you should be able to see this clearly. Okay, you got 8 samples. The treatment group is very good. 100% were cured. Okay, those on placebo, 50% were cured. So as you can see, when you do the study, when you run the analysis, since the sample is quite small, the analysis is based on features exact test. You can see that the p-value is not significant. Okay, the p-value is not significant. It is 0.4. The p-value, so it is not significant. So we increase the sample size to become 16. If we increase sample size to become 16, so what happened? The p-value increased slightly. The p-value increased slightly. Okay, the p-value increased slightly. Okay, I'm going to make myself smaller so that you all can see the slides. Okay, the sample of 16, you can see now the p-value is almost significant, 0.07, but it is not yet significant. So as though the treatment and the placebo has got the same effect. Okay, they got the same effect because the difference is not statistically significant. But you can see here already, those who are cured 100%, those who are not cured is 0%. And then you can see among those on placebo, it is only 50% that is cured and 50% that is not cured. Okay, so that is the. So what happens now? What happens now? We are going to increase the sample size some more. Okay, now we have 32 samples. So with 32 samples, you can see that there is a significant p-value. So for the two-tailed p-value for the Fisher's exact test is 0.002, which is very, very significant. So since the p-value is less than 0.05, the null hypothesis is rejected. Okay, and the treatment has a significant effect on the outcome, and the straw man, which is the null hypothesis, is finally knocked down. Okay, so that is why when we do a study, we need to have adequate sample size. Although your treatment may be very, very good, like in this case, the treatment is very good. Cure is 100%. Okay, placebo only 50%. But if you have a small sample size, the difference will not be statistically significant. It is only statistically significant after we have increased the sample size to the minimum of 32 in this situation. So the question now, what is the adequate sample size for your study? Okay. So just take note that for today's lecture, this is an abbreviated set of slides. The full set of slides is 148. Okay, so you can just go to my website and download the full set of slides. I got no problem with that. Okay, feel free to share it with your friends. It is shared in public for everyone to download and use. Okay, so you can see here for today, we're just going to focus on prevalence studies. We're also going to focus on qualitative outcome on dead and alive, and we're also going to focus on continuous outcome, such as the drop in BP in millimeter hydroserum for commonly used study designs in PPUCAM. Okay. Why is my camera not very good? I got Insta360 beside me, but the problem the Insta360 today, they refuse to cooperate. I do not know. Maybe dia merajuk dah lama tak guna untuk webcam. So today, they refuse to work. Okay, so I got a laughing face coming out there. Okay. Let's go next. Okay, so doctor, where to get these slides? Okay, all these slides, the PDF version has already been uploaded to your portal. We have a portal for you all at mooc.ucam.my. Unfortunately, nobody has registered yet. The only one who have registered are the lecturers. None of the students have registered. But just go to mooc.ucam.my, log in using your eWarga password by clicking on the red button. And once you go in, you just look for this Minggu Penyelidikan. It is under the medical academic program. And when you just click to enroll, the enrollment key is eyes window into SO. So you can check your email for the key. So each one of these is clickable. Each of these things is clickable, even in the PDF. So you can just click and get all the notes. Okay, let's say we are talking about the prevalence. Okay, you are doing a study on prevalence. So what do I mean by that? What do I mean by doing a study on prevalence? Inside your objective, you stated, I want to do a study to measure the prevalence of blindness in Perlis, for example. To do a study on obesity among UKM lecturers, or to do a study on the incidence of COVID infection among the ICU staff. Okay. So that inside objective got the word measuring prevalence or incidence, then you can use this formula for sample size calculation. So if the objective of the study is to measure the prevalence of the outcome of the interest, then you will be conducting either across, please take note, if it is a prevalence, it is a cross-sectional study. If it is an incident, it will be a cohort study or any longitudinal study. Okay, so the number of samples selected is dependent on the expected prevalence rate. So, doctor, I do not know the expected prevalence rate. My study is the first study done here in Malaysia. Then try to look for other literatures that shows a result similar to your own population. Okay, okay, just to okay, just say no. We also help you by giving you the Excel file. Okay, how to do the story? Yeah. Okay, later you go through all the website for you all to download the files. Okay, so this one we just determine the precision, which is 5%. What's the attribute is stated just now, just whatever that you find. Okay, so to determine the prevalence of obesity, okay, we set the confidence interval of 95%. We want to be 95% sure that the difference that you detected is truly due to real difference, not due to chance. So we set the confidence interval of 95%. For 95%, okay, you can see here, okay, the Z value is 1.96. Why 1.96? Because 0.475 you times it is the area underneath this part. Okay, 0.475 you times 2, you become 0.95. So 0.95, that is equivalent to the area under the curve. Okay, that is what is meant by 1.96. Okay, so we are going to go next. Okay, so we calculate manually, put into the formula. So in this example, we say we expect the prevalence to be 20%. So you put into the formula and you get the sample size is 246. Sample size required for the study on the prevalence is 246. If you go to this link, okay, this website is still on. Once I am on leave as of next year, I don't know whether I still will pay for the website. This website is paid by myself. I paid for a lot of websites, but a lot of these websites are going to expire once I am retired or when I am expired. So please take note of that. You have to download it now. Go to this link, download, and this is an Excel file. Oh, Isaac Tan, we pay for you, Prof. Thank you, Isaac. Okay. So 246. Okay, you can just go and check it out. So how do we do it? Look at the left side, 5% level of accuracy. So we look here up there, you can see 20%. Sample size required is 246. So it's very easy. Okay. Doctor, my supervisor insisted that I do a study on HIV among STD patients. Wow. Okay, and you based on the data from KKM, the prevalence among STD patients is 4%. So you cannot set the accuracy to be less than 4%. Okay, doctor, I set the accuracy at 5%. 5%, 4 minus 5 become minus 1. So 4 plus 5 become 9. So I think the accuracy level between minus 1 and 9%, which is not appropriate. So therefore, if the prevalence rate is less than 5%, the accuracy rate should be half of your prevalence rate. So if it's 4%, half it become 2%. Okay, therefore the required sample size will be 369, not 59. So please take note, the accuracy rate should be appropriate to your expected prevalence rate. Okay, so that one is the easy one. Remember, you can only use that if you already stated inside objective, I aim to do a study on prevalence rate. Okay, I aim to do a study on incidence rate or so on. So it is stated inside objective. If it is not stated, then you cannot. Then you cannot. Okay. So if you cannot, what should you? I did not set my screen properly, so I have difficulty finding my mouse. Okay, what do I mean by dichotomous? Dead or alive, disease or no disease, risk factor present or risk factor absent. So RF stands for risk factor, D stands for disease. Okay, it does not matter whether you're doing a cross-section study, a cohort study, a case control study, or clinical trial. If the risk factor and the outcome are both dichotomous, doctor, what is dichotomous? You marry two, you die. Dichotomous. Two possible outcome. So dichotomous means two possible outcome. Okay. Jeng. Okay, mouse aku hilang lagi. That's the problem when you have 3 screen, okay? Baru 3 screen. Kalau 3 bini lagi heboh. If the outcome, the dichotomous outcome, then the method to calculate sample size is similar. Either looking forward for the rate of the disease or looking back for the rate of exposure. Okay, thank you for all the laughter. I miss that. Teaching in real life class, you get laughter. Teaching online, you feel crazy because you're talking to yourself. Okay, so for example now, let's talk about diabetes. Okay, I'm on follow-up for my heart disease. I had a heart attack in 2018. So I'm looking forward to retirement. So whenever I go to the clinic, they always worried about my big size. I am obese. Okay, I am obese. How obese? BMI already 36. No hope already. Orang sahabat benang kata no hope. Tak boleh harap nak turun berat badan. Okay, so my risk of getting a heart attack is my risk of getting a diabetes is very high. So every time I go there, they take my HbA1c, always checking. Doctor, you are borderline? Yes, I know. Okay. So let's say we have 2 groups of people, those with normal weight and those who are overweight. Okay. So what are the proportion of risk of developing diabetes mellitus in normal population? And what is the proportion of risk of diabetes mellitus for those overweight? So based on the literature review, no risk 7%, high risk 32%. Okay, high risk 2. So if you have data like this, then you can just calculate the sample size. Okay, just to make life easier, you have overweight, 32% chance of developing diabetes mellitus. Those with normal weight, 7% chance. Okay, my father diabetic. Oh, my sister diabetic. Who else? My younger sister also diabetic. So family risk is very high. Oh, silap klik. Okay. So you can calculate your sample size. To calculate sample size, you can use this formula. Place JL. Doctor, I got other formula. Can. They are all similar because you may have to remember sample size is something that you are just trying to come up with a good figure. So you got so many formula, okay, and one of the many formula is place JL. I prefer place JL because there is the formula that is adopted, that is accepted, adopted by many software. Why I'm looking worried? Because suddenly my battery for my monitor tinggal 60%. And it's supposed to be running on battery on power supply. Kejap. It's on. Never mind. If things will go wrong, they will go wrong. So we let it be. Okay, so let's go. So you can calculate sample size. It's not that hard. It took me 3 days to calculate manually. Okay, so let's look at the next. So you calculate manually, it looks like this. Die like you all. Okay. Okay. So, doctor, I don't want to use. Okay, this one is manual, Okay. If you use the Excel file that I share with you all, okay, you can enter the values. Okay, remember I said what is the rate of getting the diabetes mellitus among the thin people? 0.07%. 0.07, which is 7%. 0.07 is 7%. The fat people, how many percent? 32. 32 minus 7 is 25. So 0.25. So you put in 0.07, you put in 0.25, you get sample size required 46. Only for cases. Because our ratio is 1:1. So kali 2. So kali 2 become 92. So 46 become. So you can see it is similar like the way we calculated earlier. But of course, the easiest one is to use this software, Vanderbilt software. At the top there is the link. You can click on the link and you can get the software. Okay. You enter the value. The value will generate the answer. The answer is slightly different. Okay. Remember for the Excel, I use the place JL formula. I get sample size of 92. But when I use the PS2, doctor, why you call it PS2? The name is power and sample size. S dua kali. So PS squared. Power and sample size. So PS2, so is 76. There's a slight difference because the formula used is slightly different. But the beauty is the text. The text there is generated. You can just copy and paste, put inside your thesis. Put inside your proposal. So here is the exact, in black color is the exact one that is being used by the words inside the software. The blue color is what I put in to explain based on your study. Okay, based on my study. So imagine you can just put this thing in and you are okay. Why? Because the ethical committee will be happy, your supervisor will be confused, and everybody will accept whatever you have written. Okay? Okay. So that is for dichotomous data. But some of you will say, doctor, I'm not using categorical data. My study is based on continuous data. So example, continuous data. Okay. Like the day I had some people who came to me with data on probiotics. They want to study the effect on the white blood cell. They're looking at the percentage of certain types of white blood cells. or they want to see how long before you pass motion, so they have the time. Okay, so these are all continuous data. So you have continuous data, and you want to calculate the sample size, then you must understand what you are really studying. Okay, I'm giving here an example. Okay, I am, as you mentioned, I am a heart attack survivor. I survived a heart attack in 2018, November 2018. So when I had the heart attack, my weight was only 92 kilograms. After I have the heart attack, they put me on beta blockers. Beta blockers, bisoprolol. Bisoprolol sucks. Why? It reduces your metabolic rate, it reduces your heart rate. So from 92 kilo, I become 106 kilograms. I hate bisoprolol. Sorry. I really asked the doctor to stop the treatments. Yeah, they refuse. They say this thing will make you live longer. What live longer? Give me erectile dysfunction, useless drug. Okay. So let's look at let's say we have two drugs. Okay. We have bisoprolol, we have perindoprine. That's the other drug I have to take. Okay. And you are treating a group of patients. So you find out the difference of the BP between treatment 1 and treatment 2 is 10 millimeter hydrogen. The standard deviation for the results is 20 millimeter hydrogen. Okay. So based on this data, you can enter into this formula. Doctor, why you keep giving us the formula? You can get everything here only from the software. Yes, but your supervisor will ask for the formula. So it does not matter that you did not use the formula, but the only thing you have to do is print screen and paste it into your thesis. Okay, that's why I put all my notes background putih. You have a void background, you can print screen, put into your PowerPoint. Your supervisor will be very happy, and they'll be none the wiser. Okay, I'm glad that you all like it. Okay. Okay, so this is a formula for two groups. You can calculate. So here the example, sample size required is 64 per arm. So 64 per arm, you have two treatment groups. That will be a total of 128 samples. Okay, I'm happy to be teaching here in the telesidang. I got 1, 2, 3, 4 screen, 5 screen. So I can see myself, 5 of me everywhere. Okay, so let's go next. Okay, or you can use the software that I give. The software I give, simple. Okay, what is the SDIF? SDIF is the standard deviation. Okay, and the difference. So you divide the difference over the standard deviation, and then you can look what is the power of your study. Power is 80%. Minimum power is 80%. Please note, minimum power is 80%. Sample size required is 64 per arm. So 64 per arm times 2, it become cannot see the screen. 128. Okay. Again, you can use PS2, power and sample size. Okay. Doctor, how to get the software? Google. You type the word power and sample size. Then you type the word Vanderbilt. Vanderbilt. If you like to watch the American Pie, Vanderbilt is the girls' university. Okay. Okay. Anonymous attendee. Right-sided heart failure. There's no prevalence. You can use prevalence for other countries. Okay, you can use it. Which one is suitable? Whichever gives the sample size that you want. Okay, which one? You akan adjust soalan tu. You akan adjust jawapan you bergantung kepada jawapan yang anda mahu. Okay, okay. So sorry, dah lari tajuk. Okay, so you can use PS2. You come up with the same answer. Okay, this is for the the SDIF. So you end up with sample size of 120 also. Same answer. But of course, it is better because you got this, you got the words. Okay. Otherwise, they ask me, doctor, how shall I type this? I give them PS2. They can, wow, like this, very good. Copy and paste. You all can become the master of copy and paste. Doctor, saya ophthalmology. Oh, yo, ophthalmology. Very bad news. Why very bad news? Ophthalmology always trying to compare between two drugs. And they have similar effects. So they are going to do pre and post. Why do pre and post? Budget not enough. Only got enough for one group. Alright, does not matter. If you got pre and post, just take the difference, but the formula is slightly different. So this is the formula for pre and post. For the rule of the thumb, pre and post versus dengan two different group. Pre and post, the sample size required is 1/4. Saya ulang balik dalam bahasa Melayu. Perbezaan antara pre and post dengan kajian menggunakan dua kumpulan yang berbeza, jumlah sample size yang diperlukan hanyalah 1/4 daripada sample size yang memerlukan dua kumpulan. Therefore, a pre and post study is better if you have problem with budget. Okay? If you have problem with budget, then you only need 1/4 of the sample size. 1/4 of the sample size compared to the two groups difference. So you can see here why the 2 is here, not here. Because earlier under the two different group, it is 2 times C. Here is 2 plus C. So that's why the sample size is only 1/4. It's only 1/4. So you can see here the sample size is only 33. And 33, it is similar like in manual calculation and also PS2. Okay. Okay. So as promised, I'm going to cover only prevalence study, dichotomous data, and continuous data, and I've covered that. There are others. The others I cannot cover in the time given to me. I already exceeded my time there. Okay. So I'm going to try to start answering the questions. Let's see the questions. Okay. Madam Chairperson, the floor is yours.
Thank you, Prof.
Okay.
All right. Without further ado, I'm going to check on the...
I think you're muted.
Oh.
Okay. Sorry. All right.
Okay. Thank you, Prof, for the most awaited lecture on sample size, because I'm a facilitator myself, and so many questions that's been asked during the session. So here is your chance. So would like to have the chat box being read one of the questions. Okay, I have here from Priva Tarsini. I'm sure she's there. And the first question is how to calculate sample size for explorative studies. So I think this is in the future slide, right, Prof?
No, the explorative study, when you say explorative, basically it's a cross-section study. So cross-section study, you're looking at incidence or prevalence. So incidence prevalence, so therefore the formula is the same like I showed you the first part, incidence and prevalence. Okay. For the mixed, next question, please.
Okay, next question by Kahi Wong. All right, and he also in the audience. He say, I'm conducting a study with mixed method. First method detects continuous parameters. Second method is a questionnaire, which has 3 constructs and detect continuous parameters as well. So his question, how then I do key in the values for the sample size calculation? Tricky, Prof.
Easy. You calculate for all, then you take the largest sample size. Okay, for each one of the method, you calculate the sample size. Then what is the largest sample size? And the largest sample size is the one that you use for. By the way, when you mentioned the word questionnaire and construct, it is a very specific term. So we say questionnaire and construct means basically, I assume that you're talking about the 3 different domains. Okay? And for your information, questionnaire does not have continuous parameters. Questionnaire got ordinal data. When you ask patient to score 1, 2, 3, 4, 5, that is ordinal data. That is not continuous data. Okay? Because you are asking the patient to decide. Okay? And when they're trying to decide, they do not have a ruler. They do not have a specific cut-off point. So what the patient responded to you is really ordinal data. This one is another topic by itself, okay, which is not covered under this research week. It is only covered in JKM, where there is a method of converting ordinal data from questionnaire to become continuous data, and that is called IRT. IRT is short form for item response theory. The method of analysis is RASCH, R-A-S-C-H, okay, and it is only well known in certain fields only. Example, psychology, psychiatry, and in the field of education. We do not teach this in medicine to the clinical students because usually you all do not take into account on constructing your own questionnaire. So that's why it is never covered for the clinical students. But you do have a lecture on how to count a questionnaire by Professor Madhya Dr. Azmi Mohd, which was, I think, yesterday. Okay, but she did not teach you all how to analyze. That one I do teach, but only in JKM. You can search for my name on YouTube. Just search for my name, Dr. Tamil. Then you look for the word RASH. There is explanation on how to do that analysis. But more importantly, the sample size required for RASH minimum is 200. Minimum is 200. Okay, all right. Back to you.
Okay, as for now, we have around 140 participants. But as far as I can see in the question and answer chat area, there's no question so far.
I got 6 more.
Oh, you have 6 more.
Under 7. Under Q&A.
Okay, all right. Probably
okay, this one,
it's not real time for me.
Okay.
If it's Prof can.
I think I just answered.
Okay. Right.
The person, the Kah P Wong, she continued her question. They got the 2 constructs that detect ordinal data and 1 construct. Yes, you just separately calculate sample size for each one. It's not really construct for each objective, and then you get you take the largest sample size. All right. Okay. Okay. Under the Q&A, I can see the questions, but since the chairperson cannot see the question, I will answer this for you all. Okay. The first, do we include non-responders? Yes. But please take note, we only use non-responders for cohort study. Okay. We expect, okay, you start with 300. You expect 20% will not be around to answer questions. So then we include the 200. If we're doing a cross-sectional study, selagi as long as you have not reached the sample size, you are going to continue to collect. Okay, so it's not really an issue in a cross-sectional study because you are already going to proceed. So the issue of non-responders does not exist because the non-responders does not count inside your responders. Okay. So just take note, loss of follow-up is only valid for experimental and cohort studies. So don't bother trying to include that inside cross-section studies, but by right, you're supposed to collect until you get enough data. Okay. Then the next one, the question is, prospective intervention study, not RCT, two surgical method, which formula? This one you will die. Sorry to say, this one you will die. Because why you will die? Because I guarantee you, the two surgical methods, the difference is minimal. The difference is minimal. Once you have a difference is minimal, the sample size will be in the thousands. Okay, that is a warning to you. So, for example, you have two drugs for psychiatry. Let's say we're doing study for two drugs. One is Pfizer, the other one is Zoloft. The difference of response is 70% and 75%. Difference of only 5%. So when your difference is small, what is the sample size required? You need 2,500 sample for Pfizer. You need 2,500 sample for the Zoloft. You end up with requiring 5,000 sample size just to prove that Zoloft is better than Pfizer. So therefore, it is not really suitable for you all. Because at the end of the day, you're just going to prove that the two surgical method is as good as the other. So if you're doing like that, yes, you're supposed to use comparison of rate, dichotomous, rate of success treatment A, rate of success treatment B, and you're going to use the FLIS-JL formula. Okay, good luck. You need that. Okay. Rata Krishnan Venkatasamy. Sorry, I'm not that good with names. What is the recommended method to calculate sample size in questionnaire development evaluation? Okay, I know Azma already covered this inside her lecture yesterday. So basically under her statement, she said 5 samples per item. 5 samples per item. Okay. But I'm going to give you the general, because I got, if you search for my slides, it's available online on this questionnaire development and validation. You just search, it is on slideshare.net/Dr. Tamil. There are 5 statements there showing you all the 5 different methods of sample size calculation for that. So just take note, the good way of answering this, you need a minimum of 200. You need a minimum of 200. So for you to have a good sample size for development and validation. However, if you're doing just, because you must remember, there are different stages. The first stage about testing, where you just pre-testing the software, that's why pre-testing questionnaire. But 45 is enough. 45 is enough. But when you want to validate, you need 200. All right? Okay. Your study is prospective, but you take it prospective for some reason. Yes, it is acceptable. Okay. Anonymous yang ramai benar. Thank you for clarifying the formula to calculate sample size between disease and control. Yeah. No, you don't use the prevalence disease. You use the. Okay. Basically, it's like this. You're studying the outcome of the disease based on those with the risk factor and those without risk factor. Then you look for the prevalence of the disease among those with the risk factor and the prevalence of the disease among those without the risk factor. Okay, so it is different, and it is not the formula for prevalence. It is the formula FLIS-JL, comparison of the two groups. Okay. Ashikin general surgery. I'm sorry, I do not know how they come up with this thing. Kejap keluar ke atas, kejap keluar kat bawah. So Ashikin general surgery, sample size, never had done before, and no reference paper to look for. I don't think the keyword is prevalence. I'm not sure what is your need. For general surgery, you don't do prevalence study. For general surgery, you tend to do results of the success rate or cure rate based on your method or intervention. If you do not have for that respective paper, then you look for the next best thing, which is a drug or a method similar to that. And you should be, your result of success should be at least as good as that level. Okay, so for example, you're doing a new method of doing surgery on anal fissures. Yeah? This one has been done about 5 years ago. So for anal fissures, then you have two different methods. One going beneath the sphincter, one going through the sphincter. Okay, so you just choose the best method and the success rate for the best method, and you assume what if you have this kind of outcome. Okay, what is the minimum sample size required? Okay, all right. When do we use sample size correction for finite or infinite population? If we're doing a study for the state of your mind, okay, yes, then you use for the infinite for the finite population. Okay, basically it's like this. Yeah, basically it's like this. The cutoff point for finite population is a quarter million. 200,000. Okay. I know you thought the Kish formula for the prevalence is only one part. If you check my notes, my full notes, Kish formula got two parts. The one for the finite and infinite population. So after you already got the first half, there's a second half where you put in the size of population if your population is limited. If your population is limited. So when do you use a formula for small population, the finite population? When you have a small population based on your study. You're doing a study, I am doing a study on the stress rate in klinik Kesihatan Rembau. Klinik Kesihatan Rembau, how many sample? 33 orang. Okay. So then you use the sample size for the finite population for the klinik Kesihatan Rembau. Why? Otherwise you use for the infinite population, you see, ayo, I need 200 sample, I got only 33 patient, so if your tajuk is limited, then you use for the limited population. Alright? Okay, dan macam mana saya nak dapat enrollment key untuk MOOC untuk research week? Tengok email daripada Abang Khairi. Abang Khairi dah hantar 3 kali. Siapkan video macam mana nak login. Okay? Video tu bukan video lucah, jangan risau. Video tu bagusnya. Suara saya dalam tu. So boleh tengok, dengar, saya tunjuk step by step macam mana login. Okay, gelap besar korang. Alright, so enrollment kit. Tadi saya sebut dah. Saya patut tak boleh sebut. Okay? Eyes window into soul. Kali dah jelek kat saya ni bocor sebab ada orang bayar satu dia dapat semua. Tapi dia kalau dia kena tengok dekat email sebab guarantee kalau dia type ni salah ya. Prevalence obesity in KL dan the 3. Okay, anonymous saya tadi. Ramai betul anonymous hari ni. Private study of obesity KL, dan dia akan dapat 2 kumpulan. Obese and without obese. To determine the dietary risk factors. Yeah, it is a cross-sectional or case. Okay. You are doing both. Basically, you are doing a cross-section study first to find your cases. You're doing a cross-section study first to find your cases and your controls. Then once you have your cases and control, you're doing a case control study. Not really cross control study lah. But boleh lah. As long you're not doing any intervention, you're just going to compare between the two. Okay lah. So you are really doing both. The cross-sectional part to identify who are the cases and who are the controls. And the second part where you select only a few of the cases and a few of the controls for the next part of your study. So what is the sample size for ni? You start with the case control study first. How many do you need for the case control study? Then based on the case control study, you determine to get the number of cases, how many you should do in a cross-sectional study. Okay, so you work backwards. Start with case control, get the numbers, then go backwards to do a cross-sectional study for sample size. Okay, for the sample size. Effect size. Okay, ini Ihsan Jamaluddin. Ihsan, I just found out the word Ihsan means excellence. Mana dapat tahu ni Ihsan ni excellence? Buat tengok video dekat Netflix. Ni cerita tentang Masjidil Haram dengan Masjid Nabawi, Al-Nabawi. Very good. Tajuk dia excellence. So sepanjang tengok dokumentari dia kata Ihsan. Baru tahu Ihsan tu excellence. So Ihsan, you have to be excellent, yeah? Okay. Effect size different formula. Effect size tak boleh pakai apa yang saya tunjukkan tadi. For effect size, you have to go and immediately go to PS2. So you go into PS2, you will see but probably I don't think it's cross-section study. For you to get effect size, it should be a comparison study. Because you can only get an effect size when you compare. Alright, just take note, check back. I think there's something wrong with that one. If my study period 1 year, but I manage to get sample size every 9 months, is it okay to stop study there? Of course. Unless your supervisor is the OCD type, and the type of that believe the larger the sample size is better, and then that's your problem lah. It's not my problem. You do die lah. Okay. Once you got the sample size, you'll be okay. Alright.
I rasa dekat chat ada 2 lagi. Dari
ada 4.
Kashmini, Kalila. Untuk saya bacakan.
Okay.
From Sri Kashini. Prof, I'm developing a questionnaire, but this more to survey-based study of prevalence of pain and management among pediatric cancer patients. Like using the Likert scale, it includes all the patients on peds oncology whom are newly diagnosed and still actively phase of treatment and dose in maintenance. So in a year, we have around 150 patients, roughly. My sample size is universal, but I still have to come up with a formula. So may I use the first formula to prevalence study?
The problem right now is this one. You say, okay, there's 2 parts here. One is prevalence of pain. The other one is management among the patient. So if you just about the prevalence of pain and you have a clear cut-off point, yes, you can use the study on for the prevalence. But if you are trying to relate factors that affect the pain, then you may have to use the second point, the FLACE-JL formula. So if it is just prevalence, yes, you can use on the first formula. But if you are doing for factors that are affecting the prevalence of pain, then you have to use the FLACE-JL. Okay. Next one is Khalilah, I think. 7.5 to 20%. Which one you should choose? Don't take 7.5. Anything below 10 is not good. Anything below 10 is not good. Why? Then the numbers will get too small. Then you end up problem. Okay. 20% will get your sample size of around 246. I think, sorry, 142. Okay, so which one you should choose? I would suggest to go for the larger number. So you go for the 20%. But just take note that make sure that you are not studying anything else besides prevalence. Ihsan done. Kayla done. Okay, that's it. Thank you.
Thank you, Prof. Ada banyak soalan tadi tu, more than 10. So there's 140 of them. I'm sure they will all go to the MOOC that we are recommending so much to.
I think I got one more here. Just came in. Sorry. Sasi Taran Paskaramurti. Prospective cohort study on diagnostic accuracy of laryngeal ultrasound. This one you die. Okay, I read the whole thing. Why? Then I explain to you why she's going to die. They want to do a study on accuracy of a laryngeal ultrasound in pediatric stridor. They're looking at the sensitivity and specificity of the ultrasound versus endoscopic. You cannot assume 100%. You cannot assume 100%. So right now, what is the issue here? Okay, issue 1, you need a gold standard. So I assume the gold standard is endoscopic. So you basically at the end of the day, you have to run the analysis. You have to run the sample size based on the screening method and the gold standard. For the screening method, yes, you can use ultrasound. For the gold standard, that one is your endoscopic exemption. So it means right now you have to do both for all the cases. Okay. So what is the sample size? I'm sorry to say you have to download my full set of slides. Okay, I already mentioned this now. Go to pumpx.org/sample size. Inside there, got the notes on sensitivity and specificity. So use that formula. Inside the Excel file, they have the slides there. They have the page there for the sensitivity and specificity. And please do go to my drtamil.me, click on study designs and download the paper, the third paper on doing sensitivity and specificity study. They call it under the title of diagnostic screening. All right. Okay, then I answered already, done. Last, why kena last? 958. Prevalence of different psoriasis. Okay, this is an interesting topic. Why? I think I got psoriasis, but my psoriasis is in my scalp, so the people don't see that. It has different variables in other countries. Basically, the psoriasis it is very much related to ethnicity. So therefore, the rate is different for everyone. Okay, which prevalence do you take? The one that is the closest to Malaysia. So you have to take for our majority population is for Malay. So you need to take for the rate for. But anyhow, whatever number you came up with, you're going to have trouble. I'm not going to worry about that. That's your problem, not my problem. Okay, Liana Nabiha Ihsan, animal study. Your issue, I understand the number of animal you can only get 6 per group. Yes, I know. The data will not be normal. Yes, I know. Yes, your analysis will always have to be non-parametric analysis. Okay, that's it. So sorry lah, that one out. Last one, is it okay if we mail it? Sorry, my dear, I'm retired. I'm tired and I'm also retired. So you have to go and disturb the lecturers in DKM. How to disturb them? Very important. I'm going to give you the method. I'm going to type it inside the chat screen. So please go and book them on this website. ppukm.setmore.com. You can go and select which is your favorite JKM lecturer to become your statistics consultant. Okay. And Isaac, so buat kontrak. Tak apa, saya tak mau buat kontrak. Saya mau enjoy life for once. Okay. Lepas tu datang ke HU Camp ni, Jonah sikit untuk saya. Semalam saya datang sekejap saja untuk ambil ubat. Saya punya kereta tak mau start. I had to tow my car back. It is not my old Wira. It's my X70. So Jonah lah datang HU Camp. So I don't want to come back to you again. Okay, thank you. All right.
Okay, thank you, Prof. So I think we extended the time that we should start that next lecture. It's not actually 9:45 to 10:30. Before we had a break from 10:30 to around 11. Okay, should we continue, Prof?
You're supposed to break, kan?
The break is at 10:30. So we leave it to you if you want to, like the audience, to have a 5 minutes breaks before the explorative.
Just 5 minutes.
Okay, cool. So we'll get back to all of you in 5 minutes. So we have that quick break of 5 minutes, all right?